Hello and welcome back again to my channel. If you're seeing me for the very first time, you're welcome. On this channel, we just talk about nursing content. So the topic of today's video is all about nursing clinical placement. So if you're just starting your nursing journey or you wish to apply for a nursing program, you might be wondering what a clinical placement is. So a nursing clinical placement is just the practical aspect of your nursing program where you gain hands-on experience. During your placement, you work with registered nurses and you'll be able to apply your theoretical knowledge to real-life patient scenarios. Clinical placement is a very crucial part of your nursing journey, which will allow you to develop your clinical skills, gain exposure to various medical conditions, and enhance your ability to provide quality patient care. According to the Nursing and Midwifery Council, all student nurses are required to complete 2,300 hours of clinical placement, irrespective of whether you do a 3 years nursing program or a 2 years program. Before you can become registered with the NMC, your placement hours needs to be complete. If you are doing a 2 years master's in nursing program, you'll be able to claim some hours from your RPL, which is your recognition of prior learning. At the end of this video, my goal is for you to go into placement prepared and confident. Also, to minimize the anxiety and stress that comes with starting your clinical placement. Because clinical placement is likely the toughest part of your nursing journey, it is important to embrace it with a positive attitude and you will learn a lot while you are at it. Once you receive your placement allocation, you will have to contact your placement area like a week before your start date. Some placement areas are very proactive and they will get in touch with you before your start date. They will send you a welcome email and confirm your start and end dates. They may also send you a student starter pack which contains what they do in that placement area and the type of patients they care for. They might also tell you their work timing, so you will be aware of their rota. But if they do not contact you, you will have to contact them via email, phone call, or simply by showing up. When you contact your placement area, introduce yourself. Tell them what stage in your nursing training that you are. This is very important so that they'll have an idea of the kind of things you can do and the kind of things you can't do. So if possible, you can also ask them for your rota so you can prepare ahead of time. Now that you have contacted your placement area, prior to starting, you need to do some research about the placement area you are going into. For instance, if you have been allocated a stroke ward, you need to do your research about the diagnosis of stroke so you are aware of the kind of patients you'll be looking after and the common conditions that stroke patients usually have. You will also have to do research about the most common type of medications used in that placement area. If all that is sorted and you started your placement, one thing you need to always do is be on time, be punctual. That was the first thing I learned when I started my first placement. You cannot be a latecomer. Being punctual goes a long way to show that you are dependable, and at the same time, it shows that you've got integrity. Because by the time you qualify as a registered nurse, if you get to work late, you'll be delaying the nurse that is supposed to give you handover. And you do not want to miss out on important information about the patient you'll be looking after. Another thing about being punctual is your assessor will gather information about you from all the nurses you have worked with, and you do not want them to report you that you've been coming late to placements, because most times this can have a great negative impact on your pebble part. One thing you need to know is you need to take your placement seriously. If you pass all your assignments, your essays, your exam, and you do not pass your placement, I am sorry to break it to you, you might have to do some parts of your placement again. And trust me, this is the worst thing that can happen to any student, especially if you are an international student and your visa has an end date. You do not want to meet yourself in that kind of a situation. Next thing I will say is you need to be eager to learn. Show initiatives. Show that you are interested in what you are doing. And by doing that, you'll be thinking a step ahead. It will also reflect positively on your professionalism and your dedication to the nursing profession. My next tip for you is to stay organized. Get all your nursing essentials like your fob watch, your pens, your highlighters, and have a small notepad with you. With this notepad, it's very easy for you to write down drug names, terminologies, treatments, and conditions that you come across. Once you start writing them down, you're familiarizing yourself with them and it just gets easier to know them. My next tip for you when you start your clinical placement is to always look out for learning opportunities within and outside your placement areas. For instance, if you have a patient going to the theater for surgery or you have a patient who needs a catheter, you can always ask if it's okay for you to come and watch how the procedure is being done. Another thing you need to do during your clinical placement is to always ask questions. Don't be shy. Yeah, coming from someone who is very shy. But don't be shy. Speak to the nurses, doctors, and other members of the team. Asking questions will boost your confidence. And remember, there's no such thing as a stupid question. So if anything comes to your mind, if you're not clear about a certain thing, it's just better to ask. It's better to ask a question than to do something wrong. So don't be shy to ask questions. Get your confidence. Another important tip that I have for you is to download the BNF. The BNF is the British National Formulary, and this book is your holy grail. It contains information about medications available in the NHS. On my very first placement, my assessor asked me if I had the BNF, and it was good I had it because I had to look up the medication in it. So it is very good for you to have your BNF downloaded on your phone. We have the book versions in the words, but it's very good for you to have it on your phone as well. One important tip is to brush up on your clinical assessment skills, your A to E assessment, your vital signs. It will be very useful for you because you'll be doing them very often. My next tip for you is to set professional boundaries. During your placement, set professional boundaries with your patients, your colleagues, and other members of the team. Avoid mixing your personal life with your professional life. At the beginning of every placement, list out your skills and proficiencies that you need to sign off. Discuss it with your assessor and have a plan on how you are going to achieve them. Also, keep an open mind. Don't go into a particular placement with a preconceived notion. Always remember, everyone's experience is going to be different. The world can be a busy place a lot of times, so offer to help, especially when you see someone is struggling. Remember, teamwork makes the dream work. It is also good for you to remember that you need to keep track of your clinical hours and pebble pad and record them accordingly. No one is going to do this for you. It is your responsibility to make sure that you are hitting your required amount of hours every week or at the end of the placement. Lastly, look after your mental health. Yeah, I know that nursing training is very stressful. Placement is even more stressful. So it is very important for you to look after your mental health. Engage in activities that can help you de-stress. If you've watched this video till this moment and you find this video helpful, kindly drop me a comment in the comment section. Give this video a thumbs up, subscribe to my channel, and I'll see you in my next video. Bye, and thanks for watching.